I think it's terrific that MedStar is starting the patient communication consult service. We're putting a system in place to respond whenever there's a serious, unanticipated outcome. Well, what happens to patients and their families when there's a serious adverse outcome that's unexpected? They're scared, probably terrified. They're wondering whether they'll ever get out of the hospital alive. And they have tons of questions. They want to know if it can be fixed. And what we've been doing for decades and decades all over healthcare is we've not answered their questions. We've actually contributed to their suffering. We haven't alleviated their uncertainty, we create more uncertainty. And that's when people are so desperate. They have lots and lots of questions and we don't answer them. But we're obliged to answer them. We're obliged to help them. There's a required response within a certain time frame. People show up. There's a way of doing things. It's systematized. So every patient, every time there's a serious unanticipated outcome, there'll be a response. And the people on the consult service, they'll be trained to know how to deal with patients and families, to know about the clinical issues, to know how to support the patient and the family as well as the caregiver. And then to stay in touch with them over time, to be that liaison. So it's because we know that these conversations just don't happen one time. They have to happen over a period of time to tell people what's the next step, what can we do to resolve the issue. And over time, as we find out what caused the event, we need to share that information with patients and families, as well as the care team. So I think it's terrific that MedStar is putting that patient communication consult service in place. It's exactly what's needed. We need that infrastructure so that everybody knows this is what we do here at MedStar Health for every patient, every time.